Hi, welcome back to IANS Health Talk with Dr. Akram. Today we're talking about hypertension, which I said is a silent killer for some reason, and which we are progressively talking about it. And our special guest today is Dr. Feroz Mubarak. He's a GP, but he's got special interest in hypertension. And so far we talked about a little bit about what is hypertension, how we diagnose it, and a little bit of symptoms. Now we're just going to jump in and ask him a few more questions about how do you quickly diagnose this one, apart from that.
So you need to go and see your doctor, ideally the GP. If you have got a blood pressure monitor at home, then you need to take regular readings. If you have got concerns about higher blood pressure, for example, if you have got a blood pressure monitor at home, just check it twice a day. Twice a day. You need to check both arms. Just to make sure the blood pressure difference is not more than 15 millimeters. There are two readings, you know that, the top and the bottom. We expect the top to be about 120, bottom to be about 80. So long as it's below 140, you're quite happy with it. The top reading, the bottom one is below 90, you're happy with it, ideally around 80. So if the readings, the high reading out of the two arms is within normal range, then you just keep monitoring it. But if it's higher at any point, you take two readings per day for about a week. Minimum of 4 days. Minimum of 4 days.
So one of blood pressure checking is basically not enough to diagnose it?
It's not enough for diagnosing, no. So if you want to diagnose it, you need to take both arms. If it is higher than the values I said, then you need to take it in the morning, at night, every day for minimum of 4 days or up to 7 days.
7 days.
The best way to monitor it is through ambulatory blood pressure monitoring, which is a monitor you wear, which monitors your blood pressure every 2 hours throughout your awake time. Awake time is between 8 till 10 p.m.
Okay, so that's the best way.
That's the best way to monitor, to diagnose it, and your GP would arrange it. And then if it's higher, then of course you need a repeat testing. And once it's confirmed through ABPI, which is ambulatory blood pressure monitoring, or home monitoring, as I mentioned to you, then you actually need to go on treatment depending on what category you fall.
Okay.
But it's very, very important that you get checked by your GP regarding cardiovascular risk. Because if you are younger, the risk of cardiovascular damage and kidney damage is higher than having a stroke. But if you are older, the risk of stroke is higher than the kidney damage.
So, okay, can you tell us again? So, if you're younger...
So, if you're younger, the risk of cardiovascular risk, for example, having a heart attack or an angina or kidney damage, is higher than having a risk of stroke. Okay? But if you are older, the risk is higher for a stroke.
For older people with hypertension, they have a high risk of stroke
than the heart. The heart disease risk is the same as a younger person, maybe slightly higher because of narrowing of the arteries in the heart. But the main concern for an older person is the stroke, while there is still risk of heart disease. But for a younger person, the risk of stroke is significantly less.
Let's talk a little bit about risk factors and diet.
Yeah. So risk factors, obviously, if somebody has got, as I've told you, the lifestyle changes, that's quite bad. Poor diet is one of the main contributors.
What do you mean by poor diet?
Poor diet, like I don't know, takeaway food, non-healthy food, especially high salt levels. No balanced diet. You know, you need to have a balanced diet.
So home cooked food is always advisable.
Well, prepared food is good, but it has to be healthy food. So you can't actually have a lot of carbs, a lot of rice, and no fruit or fibers, or no kind of portion managed food. You know, it's important to work on. It's a big topic to talk about.
Yeah, we need to talk diet in a separate program. That's right.
That's it.
But we touched upon it. Yeah. Okay. What are the?
So especially salt has to be low.
Yeah.
And cholesterol has to be low. So you need to think about lipids in the food. And then of course obesity is a larger part.
Obesity.
So your weight is a larger part. You should aim to have your weight between 19 and 24.9. What we say for is 19 and 25 of BMI. And lack of exercise. Lifestyle.
When you mean exercise, it's not like you have to go and jump around in the gyms and stuff, isn't it? Well, even walking, a little bit of running.
Well, ideally, cardiovascular exercise is the best.
Yeah.
So, which means you need to do vigorous exercise, which raises your heart rate up to approximately twice the normal. Your body heats up and you sweat, and you need to do for about 20 minutes per day or every other day.
So even a brisk walking for about half an hour.
So I'm talking about the best thing. So that's the best thing to do. Do it every day, every other day. If you can't do it, or if you've got other complications.
Exactly. That's why I was coming from. If an old person.
Then next thing you could do is you could do about 60 minutes. That's 3 times 20 minutes.
Okay.
Of walk. So during that walk, you can either do 20 minutes of brisk walk and stop, or you can do 5 minutes of brisk walk, 5 minutes of normal walk, and then 5 minutes of brisk walk, 5 minutes of normal walk. So that'll add up to 20 to 30 minutes of brisk walk over 24 hours. Sorry.
So
yeah. So over one cycle. So that's 1 hour, and you do it at least every day or every other day. It's important, but it's about you are stimulating your metabolic system and heating your body up, which actually help you be able to kind of burn off the fat and the kind of free radicals and things like that.
So this walk is, you have to think that you're walking and you get ready and walk. It's not like you have your cell phone on your head and talking to your friend and just going a leisure walk around the park. It's not that, is it?
No, it's a very common question. Some of my patients ask, I take my dog for a walk, and that is not exercise.
That's not exercise.
Unless you walk for about a mile or two. The reason being is you stop when the dog stops.
Yeah.
And the pace is very, very low. It's better than not walking at all. Don't get me wrong. Right, it's better than just being at home and just watching telly all the time.
I'm going to hold you there. There's a caller online. Let's get the caller with us. Hello.
Hello, assalamu alaikum.
Wa alaikum assalam. What's your name?
It's Shahnaz Begum. Can I speak to Siliti Bengali? Is it possible?
Bengali? Yes, you can ask the question in Bengali. My guys in the studio, they will translate us.
Okay.
Go ahead, please.
Basically, আজকে আমার লগে একটা like happen হয়েছিল সকালে, like আমি সকালে গেছি মুসলিতাম, আমার like আমি ফুললি করতাম পারলাম না, আমার এক্সাইটেড লাগে, মানে পানি ফুললি করতে কালো লাগে, পানি সাইডে দিয়ে আইড্রো করিজারো প্লাস আমার এক্সাইট চোখ লাগাইয়া ডিফারেন্ট হয়ে গেছে, গলা ফিল করাম আমি, এখানে আমি খুললি লাগান মুখে বানাইছি, আমার এক সাইড চূড়া ঠেরা লাগে, এসে আমি আপনারা শুনলেন আমার কথা?
Hello, yes, you are still with us, yeah. Now he is going to translate your question, yeah.
আপনারা আমার কথা শুনলেন?
Would you like to talk to her and clear the question and come back to us? And meantime, we keep discussing our topic. Okay, let's go ahead.
Yeah. Okay. So we were talking about the exercises, and so long as you do an exercise consistently, it's very important. What a lot of people do is they watch a TV program, they see this clip in the WhatsApp, and they get all wound up, I need to really work out. They go and work out for a week and job's done. And that is more harmful if you actually do it quite vigorously. Important thing is to slowly build up and be consistent with your exercise. Even if you go for a walk for half an hour every day, maybe a couple of hours after you have your evening meal, that's much better than you just do 4 hours of exercise for a week every day and then you leave it. Because it's about how you modify your body. There are an array of benefits in exercising, especially how you modify your arteries, how you modify the capacity of your heart to pump, how do you modify the blood supply to your brain, how do you rejuvenate yourself. It's all to do with how your body is kind of remodifying for exercise. It is very, very important you build up very slowly and then kind of come to a more maintenance level.
So general advice will be walk 1 hour. Think about walking. It's don't hang around in phones or don't stop for dogs and stuff, but think this is your exercise and you're doing it. Correct. And do it regularly.
Correct, yeah. And then while you walk, try to speed up a little bit every 5 minutes if you can, because then you will feel a bit of a rush of blood and you feel hot. And then once you're a bit of a shorter breath, just kind of slow down, but don't stop. So then for 5 minutes you catch your breath, then you will be fine again. And then you try to build up a little bit more faster for the next 5 minutes. It's 5 minutes brisk walk, 5 minutes normal walk, 5 minutes brisk walk, 5 minutes normal walk. That is the best way to maintain a steady way of exercising. If not, you would do for 10 minutes and then you'll stop and start grasping for breath, and it's not really healthy.
That's excellent. Okay, let's talk a little bit about diet.
So diet, it's important you have balanced diet. So there are 3-4 elements you need to look into, especially concerning hypertension. I'm not talking about healthy diet eating as a topic. I'm talking about which concerns hypertension. So first thing you need to make sure is it is a balanced diet. So you got kind of slow release carbohydrates. You have got some fat in it, which is fat is also useful for the body. You do have some fibers. It's very, very important you have fibers because you also reduce the absorption of carbohydrate, quick release carbohydrate, which can give you a lot of glucose in your body all of a sudden, within few minutes of eating. And also it is important that you have got a balanced salt levels in it. The ideal way to go forward is don't have any added salt in your food. So you, apart from the amount of food you put, usually about 1 spoon of salt in each curry. Try not to have any added salt, especially when you take takeaway or chips, fish and chips. Try not to put added salt in. It's very important. And also cut down processed food. Processed food has got a lot of sugar in it, a lot of preservatives in it, and also a lot of salt. So it's better to just avoid processed food. This includes burgers and things like that. And also about the size of portion as well. Try not to have too much food, especially the times you know that you would not be doing a lot of physical activities. What I'm coming to is your evening meal, because a lot of people have evening meals between 8 and 10, and they're in bed. If they eat at 8 o'clock, they're in bed at 10. So you don't give enough time for your body to absorb and utilize it. So your evening meal has to be the smallest meal, and also it has to be ideally 4 hours before you go to sleep. So if you hit the bed at 10 o'clock, you should have finished eating by 6:30. So ideally, whatever the food, larger meal you have, try to stick to your lunch, and of course have a very healthy breakfast, because breakfast has to be your most important meal of the day, and it has to be balanced as well. And don't forget water, because most of the effect of high blood pressure come from your kidneys. So if your kidneys are working very well, it will filter out excess salt, and also it will get rid of more fluids in your body in an adequate amount. So if you maintain a healthy kidney, your blood pressure will be, number one, most likely to be normal, but even if it's normal, you are more likely to respond well for the blood pressure treatment. Because obviously, if all those measures, lifestyle and diet, doesn't improve your blood pressure, you need to go into medical treatment of blood pressure. And one of the first and the most important treatment for blood pressure is something which works on your kidneys, which make the kidney to get rid of excess water and also salt. And for that reason, it's important that you drink plenty of fluids.
I have got the translation for the question.
Okay.
The lady who called us in Bengali language, she's got apparently one side of face, she's got kind of numbness, and the feeling is also different. And she has called the GP, and GP has given some medication. She just probably wanted to ask a little bit about that.
Okay, so we need more information for this because it depends on how old she is. So if she's, I would say, below 40, below 50, she doesn't have any high blood pressure, she doesn't have very young onset stroke or cardiac disease. This is very, very likely to be Bell's palsy, which is an inflammation or irritation of a nerve which supply to one part of the face. It's unlikely
Feroz,
to be...
while you're talking, let me get another caller. I'll keep him online and we'll go with your question.
Sure.
Then we will answer this question.
Okay.
Hello, sir. You are talking to us.
Hello.
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 Hi. Welcome.
Hi.
What's your name?
My name is Nazma.
Nagma. Can you be with us? Just listen to our what we're talking now. We've been answering a question, And
Okay.
after that, when he finished this question, we'll come back to you and listen to your question. Is that all right?
Yeah, okay.
Just hold the phone and listen to our program, okay?
Okay, so I think it is very unlikely to be anything to do with the blood pressure. I think it is to do with irritation of the nerve. It's difficult to say because it's a very limited history. So there's a lot of factors to exclude before I can give you a conclusion. But if it is to do with the blood pressure, then it is to do with some kind of a brain hemorrhage on a younger person rather than a clot. But it's unlikely to be any of those coming from the brain because of the short history. In my opinion, if they have spoken to the doctor and the doctor have given a tablet without examining the patient or sending them for a brain scan, this is very likely to be a very simple problem, which is a cause either through a virus affecting a nerve, causing an irritation of the nerve, giving numbness called Bell's palsy, which is one side of the face will be number, and they will have a bit of a facial droop as well in that side. If that is not the case, then they actually need further review by the doctors, by A&E. Okay.
Okay, thank you. Nagma, you're back with us. Can you go
Hello.
ahead with your question? Thank you.
Yeah, I'm calling about my husband. He's got high blood pressure. Like 3 weeks now, the GP prescribed him some Rampiril. After taking them, he gets like very bad headaches. He told the doctor as well, but he didn't say much. Should he take this medicine or?
Okay, so your husband has high blood pressure and he has taken Ramipril and he's got headache now. Is that right?
Yeah, yes.
Okay.
Okay, I just need to ask you a couple of more questions. Number one, so he's known to have blood pressure for how long?
3 weeks now.
So only 3 weeks. He never been diagnosed of high blood pressure before that 3 weeks?
No.
No, and this is the first time he has tried the Ramipril?
Yes.
Okay, he doesn't have any cough or anything like that?
No.
No, what was his last blood pressure, do you know?
Last, I just check on, I wrote it down here.
Okay.
1 second. It was 116, 84, 60.
115, 84, 60 is the is the pulse. So when he was diagnosed, before he was started on Ramipril,
Yeah.
what was his blood pressure? Do you know roughly?
No.
No, okay.
No.
So when he was diagnosed, we say just before he was started on Ramipril, did he have headache or not?
Yeah, he had a very bad headache.
Okay, how different is that headache to the headache he has now since he's been started?
I just asked him once.
Okay.
Tell me headache. Headache. Yeah, I get it. Yeah, same.
Okay, so two things to consider. If he has had headache and it hasn't gone away, since he has got the Ramipril, I think it's unlikely to be the Ramipril which is causing it. That's one thing, okay? The second thing is, if he has had headache when his blood pressure was higher, when he was diagnosed, and then he was put on Ramipril and his blood pressure improved, but the headache came back, that can be something to do with the Ramipril, even though unlikely. But the best thing to do here is, if his blood pressure is normal, consistently normal for a whole week, if he still have got blood pressure or he feels the blood pressure has come back, there's a gap between he had blood pressure, headache, and then it got better and he has come back. You got one of the two things to do. Number one, you can stop it's all dependent on what his blood pressure before. For example, if his blood pressure was 200 over 120, he shouldn't be stopping Ramipril. Okay, but at the moment his blood pressure is well within normal from what you're telling me, 120 over 60 something, right? Yeah, so that is well within normal. You can try to stop the Ramipril for a week and see, but you need to monitor his blood pressure every day, twice a day, by the way, okay, if you're stopping the Ramipril, and for a week, and see if his headache goes away when the Ramipril stopped, okay? So if his blood pressure, if his blood pressure is still within normal range, once he stopped the Ramipril, which you are monitoring for a whole week, and then his blood pressure, his headache gone away after he stopped the Ramipril, my suggestion is restart the Ramipril again after a week to see if his headache comes back. You understand? Okay?
Yeah.
So if his headache come back when you start the Ramipril, then you know it is the Ramipril. You understand, right?
Yeah,
Shall I-
but his GP told him to continue to take them.
Yeah, so I think your GP thinks it's not related to Ramipril, and I feel the same. It is not related to Ramipril, but if he has got this strong thoughts about it is to do with the Ramipril, that's the only thing you can do. So long as the blood pressure is within range now, you can stop it for a week and see if the headache goes away.
Yeah.
If it goes away, you restart the Ramipril and see if the headache comes back.
Yeah,
But my opinion is that his headache may be coming from something else. And that may be something to look at. Did he have his blood test done? Was he anemic,
No.
anything like that?
No.
So he need a blood test done.
Yeah.
Has it-
After he's taking the Ramipril, his blood pressure came down.
Yeah. No, that's good. So we know Ramipril is working, but we don't know it is the Ramipril causing the side effect. Do you know what I mean? I think it's
Yeah.
unlikely. The only way you would know is by stopping Ramipril and restarting again.
Okay.
But my opinion is it's unlikely to be the Ramipril causing it because he had the same headache before he started the Ramipril. The
Yeah.
best thing he need a kidney function test anyway after 2 weeks of starting the Ramipril. So
yeah,
you
he's
need
gonna
to
go for blood test. Yeah.
yeah,
He's
so
going-
you need to mention to the doctor because doctor may want to add something else to the current blood pressure, the blood test what he has requested. So before you have the next blood test, speak to the doctor to
Yeah.
see whether he want to add something. For example, to
Yeah.
exclude any anemia or anything like that. Okay?
Okay.
All right.
Yeah. Can I ask you something else, please? What is the normal pressure number?
Normal blood pressure. How old is your husband?
58.
Okay, so we want his blood pressure to be below 140, the top one, and 90, the bottom one. Is he diabetic?
No.
No, and he hasn't had any cardiac problems or kidney
No.
problem before. No,
No,
for
he's
him,
fine.
his top has to be below 140, over 90.
Over 90.
Okay, so ideally around 120 over 80. Yeah, that would be the best
Okay.
blood pressure he can have, below 80.
Okay, thank you.
Okay.
Nagma, thank you very much for being with us and hope we answered your question. And let's go quickly. We've got a few minutes left. Let's talk a little bit about treatment.
Okay, so treatment, if you did all those, lifestyle modifications, the diet, and you start exercising, you start to lose weight, and you change your general lifestyle, then if your blood pressure still doesn't go down, we are giving about 3 to 6 months for you to change your lifestyle, then you need to go on a treatment. So the first line of treatment at the moment, unless you are an Afro-Caribbean origin, you need to go on something called AC inhibitors. It actually works on your kidneys mainly.
So you target your kidneys first.
To just make sure that it kind of get rid of the fluid
Right.
while it just retains a certain salt, for example, balance between potassium and sodium. And you take the first line treatment. Every time you started on a treatment, you actually need to check your kidney function every 2 to 3 weeks if you are on a new treatment or if you change your dosage. Okay, and you try the first line treatment. If it doesn't work, you titrate it up to the maximum dose. If you still not improve, then you need to be on a second line treatment. So that's something called a calcium channel blocker. It's a different type of a blood pressure tablet. And you try the second line, you slowly titrate it up. You're still not better, you would have to go on the third line. A lot of people who has got blood pressure will end up being on 2 to 3 tablets. It's important to be on those, and most of the time this treatment will be lifelong unless they can make a day and night difference to their lifestyle and their weight. If someone is quite heavy, of a BMI of 35, they just bring it to 25. Or somebody has got very salty food, very unhealthy food, they just change everything completely. They start to do regular cardiovascular exercise almost every day, every other day, and they are under 40, maybe under 50, they may be able to change it around.
Change it around.
They may
so
be able
they can
to.
even
Reverse.
Reverse.
They will
so
reverse
that
the
they
high
will not
blood
have
pressure. They may be able to, but they need to be absolutely dedicated to be able to do it. It's not guaranteed that will happen, but there is a chance. If not, you're more likely to be on this treatment for the rest of your life.
But if they do these things, what you have asked them to do, even the treatment will work better on them, isn't it?
It would, but I'm just saying if somebody doesn't want to be on things. But it's always better not to be on a treatment if you don't have to be on. The most important factor I forgot to mention is smoking. Just remember that. Smoking directly have got an effect on stiffening of your blood vessels, including clots and thrombosis, atherosclerosis, and the dynamics of cholesterol, how it works in your body, and also blood pressure and heart disease and all kind of cancers. I normally call smoking is the mother of all cancers, and also stroke. So it's very, very important that you are a non-smoker, not a smoker of 1 or 2 a day, a non-smoker. Very, very important. With regards to
passive smoking as well, isn't it? If someone smokes at home.
Passive smoking, if you are a regular passive smoker, it's more harmful to you from a cancer perspective than a direct smoker, because direct smoker uses filters. So the cigarette has a filter, so it filters out most of the carcinogens in it, especially tar. Whereas a passive smoker is not going to have a filter. They're going to I'm going to smoke that air. I'm going to inhale that air from the smoke where Akram smokes. So that's going to go into my lungs with all the carcinogens. It's important because if you've got a chain smoker in the house, you need to be very, very careful.
Very careful. Okay, what's the advice?
The advice, I would say 3 things. Number 1, look at yourself overall, 360 degrees. Don't just think, okay, I'm going to just change my diet. You need to think yourself in all directions. Put yourself in a profile. Am I at a high risk? How many of my parents or their siblings or my sibling has got cardiac disease, diabetes, heart problems and stroke? And if you got every single risk factor adds up and multiplies your risk of all the diseases what I mentioned to you, and especially Asians and Afro-Caribbeans, you need to be extra careful about these vascular diseases. And don't forget about diabetes in the background. It lurks around in everybody's background, so you need to be careful. Once you modify these risk factors, you will actually modify the risk factors of the other long-term conditions like diabetes and heart disease. Very, very important. You look at yourself 360 degrees and plan things what you can achieve. It's important that you think you know what your limits, what you can manage. You may not be able to achieve what your neighbor achieves because they may be more dedicated, their work style may be different, their stamina may be different, or they might have no other commitment that you have. You may be a woman of 35, have got 5 children. You cannot go for a cardiovascular exercise every day for 2 hours, especially if you have a child under 2. You would be having to put the child to sleep. So it's important you have a practical way of planning something for you. There is nobody who can turn around and say, I can't exercise, I can't change my diet because my lifestyle. You just need 20 minutes a day, and that's your time. It's your time, you deserve it. And if you can spend that time for yourself, you would actually give back a lot to your family, your children. You will live longer, or healthier, should I say.
I just want to interrupt and ask a quick question. It's always my mother, my sisters, and everybody say, I don't have to do any exercise because I do enough kitchen work.
Now, I've got this from motorway workers. When I tell my motorway workers, oh, listen, your weight is high, your glucose is high, your diabetic marker is high, your blood pressure is high, you need to start exercising. Doctor, I rip off tarmacs in the motorway. What kind of exercise do I need to do? There's only one answer I give to them. If I do your job, it would be an exercise for me because my body is not used to it. Okay? But you do this day in and day out. What you do is you just put a lot of pressure in doing work for 5 minutes, 10 minutes, rip off, then you rest. You know the kind of food you would have. They would have burgers, they would have a lot of fizzy drinks. So their lifestyle isn't good. So yes, doing physical exercise is better than not doing physical exercise. So for example, working at home is better than doing an office job, obviously, but it's not exercise. As I mentioned to you, do 20 minutes vigorous exercise if you can. If you can, go for running or treadmill or whatever you do, quick and fast for 20 minutes flat is good, but don't build up slowly. Do 5 minutes first week, 10 minutes second week, like that slowly, but be consistent with this every day, every other day. Or go for a walk, as I told you, 5 minutes normal walk, 5 minutes brisk walk, but don't think that exercise is just going to sort you out. diet, lifestyle, sleep properly, because it's very, very important you get a decent sleep, because your psychology determines everything. And also sleep lets your brain recover and your body recover, your muscles recover. And lastly, water. It's we seriously underestimate water, and having 1 glass of water is not the same as having 1 glass of any caffeine-rich food, for example, tea. So a lot of people actually say to me, oh, I drink 6 glasses of coffee. No, that's bad sometimes if you're over 40, because caffeine can increase your heart rate, and that can actually give you complications. So I would say don't have more than 3, maybe maximum 4 cups of tea. Try to stick to 3 if you can. Drink normal water, not flavored water, about 4 to 6 glasses. That's 2 to 2.5 liters a day. And that will actually keep your kidneys healthy, your skin healthy, you'd have better skin, you will feel well in yourself, you'll encourage your metabolic system to work better. And the 5th one is your psychology is very important. Exercise will increase the well-being. You will feel better in yourself. And also, it's important that you become a role model, especially if you're a father or your mother. It's important you show that to your children that doing exercise and activity should be part of your life. Especially in our Asian community, we don't have that preset. So nobody is a role model to our children as a preset that we have healthy food, we calculate our food, we work our agenda for the food for the whole week. So everybody know what we are having. And that's how you work out your portion size. And also you're visibly working out in front of your children will set in their mind, we need to work out, we need to do exercise. And this is the way we need to go forward, especially as Asians. It's very important we change our mindset so that our body follows that way.
Feroz, thank you very much. It's a great talk, and we enjoyed. Unfortunately, we wish I had more time, but we're coming to end of the show.
It's my pleasure.
And thank you for all being with us. Anyway, by the way, next week we have a specialist in cardiology, and a cardiothoracic surgeon is with us, and so we're going to talk about heart disease and heart surgery. So don't forget to tune on your TV or on your Facebook or 8 o'clock INTV. And by the way, thank you for being with us, and if you have any questions, we can always send a message on our Facebook or Twitter. It's Iron Health Talk with Dr. Akram. You can always send a message in our Facebook live link, or you can always write to us healthtalk@intv.co.uk. And by the way, for being with us and listening to this wonderful talk, thank you very much. We'll see you next time in a similar episode. Until then, look after yourselves.